Standing on the existing protocol, my name is Omokwe Sylvester Usagi. I'm onto the stage to present a seminar on the topic lymphatic filariasis, causes, prevention, and treatment. Lymphatic filariasis is a parasitic disease caused by a microscopic thread-like worm. And the adult form of this worm live in the lymphatic system of the human. Now, introduction proper. Lymphatic filariasis is the second most common vector-borne disease globally after malaria. The disease is the second leading cause of permanent and long-time disability in the world, inflicting serious public health and social economic problem in endemic communities. The global effort to eliminate lymphatic filariasis as a public health problem focused on mass drug administration, following community diagnosis using the prevalence of hydrocele and lymphedema as rapid diagnostic features. Now let us take a look at how it is being spread, that is the epidemiology. According to World Health Organization, there are 120 million people in tropical and subtropical areas of the world affected with lymphatic filariasis. About 25 million men have the genital disease, as clearly shown on the picture here, the hydrocele. And about 15 million, mostly women, have lymphedema or lymphatic of the leg, as also shown in the picture, for those who do not know the lymphatic. In Nigeria, Anopheles species are the principal vector of lymphatic filariasis. The causative agents of lymphatic filariasis include the mosquito-borne filaria nematodes, Mucorales bancrofti, Brugia malayi, Brugia timori, of which an estimated 90% of lymphatic filariasis cases are caused by W. bancrofti. Now, for those who do not know the mosquito I'm talking about, this is the mosquito in case you have a doubt of which mosquito I'm talking about. It's a common mosquito everyone knows. Now, in the clinical manifestation, how to know the symptoms. The clinical manifestation of lymphatic filariasis are varied, but can be grouped as 1. Asymptomatic infection. This is when you don't have any symptoms outside, like you don't have any burns, you don't have any skin rash and the like, but in the body you have fever, dizziness, and the like. Then the second is the acute clinical disease. This is when you have acute problems in the body. Even the lymphatic you just saw just now, lymphatic you saw just now is one of the acute clinical disease. Now the chronic pathology, this is where you get to the worst parts of the disease. Like you have the lymphedema, the genital disease, the swollen scrotum, and the like. Now let us see how we get to know this disease, the diagnosis, how we get to make verification. You know, scientists do not believe in fear without experimental evidence. Now, to diagnose, you can diagnose it through blood tests, taking of blood and doing analysis in the laboratory. Identification of microfilaria in the urine and hydrocele fluid. You can take the urine sample and analyze it, or the hydrocele fluid. Hydrocele fluid, maybe the swollen part of the body, like the scrotum, you turn it open, take the liquid that comes, or the fluid that comes out of it, then take it to the laboratory and do the analysis. Identification of adult worm in lymphatiasis, or in lymphatic, in the filaria lymphatic. That's identification of adult worm in lymphatics. This is when you get to identify the worm. If you are used to the worm, you know how it looks like. Then when you see it when it comes out of the body, you get to check if this is the lymphatic worm or not. The immunological tests. This is when you check for um, the the efficiency of your immune system to fight against the disease. Now, having know how to diagnose it, we got to check the treatment. Treatment of lymphatic filariasis depends on some of the drugs such as ivermectin, albendazole, and diethylcarbamazine. These drugs work to dispose of the larva one, to hold the to hold the reproduction of adult one and kill it. Some studies show that killing of adult one with treatment by doxycycline, doxycycline is very efficient as well. Then, in chronic cases, surgical intervention is necessary, such as hydrocell surgery and lymphodema surgery. Now, take a look at the prevention and control. According to Center of Disease Control and Prevention 2020, the best way to prevent lymphatic filariasis is to avoid mosquito bites because mosquitoes that carry the microscopic worm usually bites between the hours of dusk and dawn. If you live in an environment with lymphatic filariasis at night, sleep in an air-conditioned room or sleep under a mosquito net between dusk and dawn. Wear long sleeves and trousers and use mosquito repellent on exposed skin. Another approach for prevention includes giving entire community medicine that kills the microscopic worm. Annual mass treatments reduce the level of microfilaria in the blood and thus diminishes transmission of infection. Having known that, we now arrive at the conclusion that lymphatic filariasis is the most second is the second most common vector-borne disease globally caused by infection with a parasitic filarial worm, Wucheria bankrupti, Brugia malayi, and Brugia timori. Mosquito is the mosquito is a vector of lymphatic filariasis. In Nigeria, no fellow species are the principal vector for lymphatic filariasis. Its clinical manifestations are varied, but can be grouped as lymphatic infection, acute clinical disease, and chronic pathology. An efficient method of controlling this spread is through the control of the vector mosquito. At this moment, draw the curtain and call it a time. Thanks for listening.